My objection to Obamacare is multifaceted. The first is that I don't believe that the federal government should have the authority to tell you that you have to buy insurance or not buy insurance. I object to the employer mandate that would add $2,000 or $3,000 per employee to the cost to employers to employ people. But most importantly, what I object to about Obamacare is that it doesn't do anything to address the most significant issue in health care. And the most significant issue in health care is the cost of health care. I mean, one of the reasons that we don't have access for many people is that they can't afford to buy health insurance because it's so expensive, because health care is so expensive. I believe that the solution to this is to put far greater emphasis on primary care, a far greater emphasis on working with people to manage chronic conditions so they don't migrate into acute conditions, because that's what really drives costs of health care. I tell people I'm a recovering economist. That was what I trained in undergraduate study. And one of the things I learned in my study of economics is that when things are broken, the incentives are usually broken. And we have tremendously broken incentives in healthcare. There's an incentive for people to consume more than they need. In fact, studies out there say that between 35 and 50% of the healthcare that we consume is either wasted or unnecessary. And so if we can eliminate the waste and the abuse and the lack of necessity in healthcare, we can lower costs dramatically, potentially 35 to 50%. So by focusing on what are called patient-centered medical homes, working with the provider community to deliver primary care through that mechanism, with a compensation system that encourages people to engage in primary care and management of chronic conditions, we can dramatically lower costs. We also need to do liability reform, because a lot of that wasted utilization is because of defensive medicine. Doctors are ordering care that isn't necessary, or they wouldn't ordinarily order. So the point of that is that by making those changes, getting rid of defensive medicine, changing how we deliver care and compensate for it, we can dramatically lower the cost for everybody in Montana.